What's happening?
Well, he's horrible. He's 2 months old.
Right.
He had a back tension. Yeah.
Okay.
Uh,
How was labour? How was pregnancy? Let's start off with the basics.
Yeah.
Was it okay?
Yeah. Was
Everything was happy? Everything was good?
Yeah.
Going well? Okay. And childbirth? Talk to me about childbirth and labour. Was it a long labour, a short labour?
Was a C-section actually.
Yeah, planned C-section?
No emergency.
Okay, how many hours were you in labour before this?
Oh, I didn't remember exactly, but I think 1 day.
Okay,
One
that's
day.
fine. Was he sitting low before this? Was he sitting engaged? Was he sitting low for a couple of weeks?
No.
No pelvic pain, nothing like that. Was he irregular inside you? Did he move around a lot?
Yeah.
Lovely.
Yeah.
Hello again. You're so delicious. Okay, so you had a traumatic childbirth, then there was an emergency C-section.
Yeah.
How has he been since birth?
Science.
Hmm?
I don't understand.
Has he been able to sleep? Is he not able to sleep?
Yeah, he's sleeping.
Yeah.
But from 1 week ago,
Yeah.
he sleep less than usually
Okay.
and eat less than usually. But
Okay. Is he going to the toilet for a poo quite a lot?
No, she poop 2 days.
Okay, every 2 days.
Every 2 days.
How about eating every 3 hours, or is it more?
Yeah, every 3 hours.
Okay.
Yeah.
Breast or bottle feeding?
Bottle.
Okay. How many ounces are we looking?
Sometimes 90 or 120.
Depends.
Yeah.
Hello, you again. Is he being sick afterwards? Anything reflux? Anything
Yeah,
coming up?
He had some problem with reflux, but now it's
Calming
getting
down?
better. Yeah.
When he does have reflux, if he is sick, does it look like cottage cheese? Does it look a bit like yogurt?
Yeah.
Okay.
Sometimes.
No, hello, you were in love with me today. Nice to see you. What you doing? Okay. And you're turning up here today because he's unsettled, or what's his problem?
Yeah, he stay on one side
Okay.
most of the time. Is
Okay.
the right
Yep,
side, yeah.
that's tickety-boo.
Yeah.
Okay, this is absolutely perfectly normal. Babies, when they're being born, okay, it's like trying to get a parcel through a letterbox, if I'm being politely put. Lots and lots of babies' heads either get wedged sideways or tilt backwards, and they can't escape. They even get their hands sometimes stuck on the side of their head like I'm demonstrating. Now, the only snag is they're not coming out. And then, obviously, the midwife calls it, and then they have to pull him out the other way. The only problem is they're being pushed like this, and suddenly they're pulled the other way, and this happens. And then they twist them as they come out. Now, your midwife is there to, create birth. However, they don't realise that babies can get a form of whiplash. Now, a baby's head is 3 times bigger than ours in relation to its body. If you look at the picture on the wall behind me, see above my head? See the yellow-headed person? Yeah? See how big a baby's head is? 3 times bigger. We grow into our heads. Now, the only snag is that's a big head and a tiny neck. So if there's a trauma, what can happen is they'll go tortoise, yeah? And then one side will get affected. Now, we're going to look at some lovely beaky neck sausage muscles. They've got a silly name, sternocleidomastoid. But what we're going to do is we're going to show you on a picture to your right-hand side of a lovely muscle. Dario, if you could assist. Sternocleidomastoid, please. And if you look at this red picture a second, yep, see the neck sausage that comes down the side? In a baby, that commonly gets injured. Now, if that happens, and you've got one on each side, one turns one way, one turns the other. If you injure one way, guess what? It will glue you, and you get these babies constantly like so. And they want to go, and then they go boing, 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 boing. Now, it's so easy to fix. And we're going to give you a bit of homework to do.
Yeah.
What else are you thinking?
One more problem. When it's on my chest, yeah,
Yes.
he gets up his head. But when he's on the floor, on tummy time, he doesn't want.
Nope, doesn't want to know, does he? No, there's 2, and I bet he doesn't like tummy time that much. Yes, Kofcom. Does he have a favourite side when you're feeding him? Do you usually put him in your left arm so he's facing towards you and you've got the bottle in your right hand? Yeah, that was norm. You'll find if you try the other way, he can't feed very well. Sadly, with babies' throats and their tongues, yeah, and the front of their necks, they do all the magic. It all happens from the front. If they get an injury and they turn, it's very, very hard to turn the other way and swallow. I know it sounds weird, but try this for me. Tuck your neck all the way into your shoulders like I am.
Yeah.
Try it. Yeah. Pull your head all the way in. Tilt your head backwards a bit and try and swallow for me.
Yeah.
Oh, it's hard, isn't it? That's how babies present here. Now, as babies grow bigger, from say 3 kilos to 4 kilos to 5, yep, this neck sausage muscle should grow with them. Yep, but it doesn't. It actually gets tighter and tighter.
Yeah.
As they get bigger, it stays small. It stays the size the day it was injured. So they get more and more twisted, and then their heads start to flatten. So we're going to have a look at him today. We're going to be double checking, feeling his neck, and then we're going to just unravel like a spring. And these babies love it. And you are the mellowest baby I think we've come across so far. So let's pull him out if we can. Whilst we're doing this, is he on any form of medication at all? Any laxatives, anything in the formula, anything like that?
No.
What formula are you using?
Aptamil one.
Are you finding that's good?
Yeah.
Is he liking it?
Yeah.
Yep, tickety boo, happy days. And are you using anything like probiotics with it?
Yeah. It's something Biogaya with.
Good.
Yeah.
You're doing that as well.
Yeah,
Excellent.
I
Well,
gave from the birth. Yeah.
good. The other thing we're going to do today as well, we're going to look at his tummy. Now, people don't realise that the left-hand side of a baby's tummy and on you is the worst blood supply to the tummy. And that's where the digestion slows down. Inside his tummy is a big, long, wiggly tube of muscle, his intestines. And we're going to find that that slows down as well. So when the neck is compromised, yeah, and he's doing what he's doing by turning to the right, he's struggling. Yep, all the blood that should be in his tummy goes into his neck and his shoulders, and it goes into what you call a stitch. Some people call it colic, we call it a stitch. We're going to jumpstart his tummy and help him poo today. It's so much fun. All right? So my colleague Dario is now going to have a feel, but we're going to need him out of his lovely blue onesie. Aren't we gorgeous? So if you can take him out of that baby grow for me. Game on. And we're going to have a lovely look at him. Hello, how are you doing? Now, whilst we're talking here, or whilst you're doing that, I'm going to be talking about lovely little Oliver, is we're looking to a baby's tongue to stick out quite a lot. And I notice it just comes to his lips, but it doesn't fully come out. He seems very happy. Is he a happy baby?
Yeah.
He is a happy baby. There we go. So we're going to gently rest him on the pillow if we can, please.
Yes, please.
Thank you.
Ah, good hair.
Yeah.
Wow. So what we're going to be doing now is we're using our hands to feel his neck, okay?
Just for you.
So the key area that we're going to be looking at, we're demonstrating, is just behind the earlobe on the edge of the jaw. A lot of action happens in this area. Now you've got these two sausage muscles, one on the left and one on the right. Now if you place your finger behind your earlobe, by the edge of your jaw, press on yourself, poke behind there, a little bit higher. Yeah, go all the way up and come forward near your jawbone. Come forward towards me. Yeah, there, that big sausage there. Go all the way up and now poke with your finger and massage it. Go up really, really high for me. Up by your ear and come forwards. Forwards towards me. Forwards. A little bit further forwards. There. That is where the trauma occurs in babies.
Yeah.
Now this is where we're going to find and going to have a lovely look on both sides. And from this we're going to see if both the muscles are in a good state. As he likes to turn towards me, 99% of the time we're going to find the problems coming from his left hand side. This is where people get it wrong. So what we're looking to feel is, we're looking to feel that these muscles are super soft as his face. However, if we find that they're lumpy, a bit like a defrosting sausage, then what we find is that means the muscle is tight and it's going boing. How is it feeling?
It's quite tight both sides. So I'm just gonna ease those up.
There we go. Hello. How you doing? The technique we're using is like a circular massage technique. And we're going to be aiming literally all the way down the edge of this muscle, follows the edge of the jawline, and it kind of originates just under the earlobe. And this is a bit of homework we're going to be giving you later. Babies commonly go from being giraffes in a neck trauma, they turn into tortoises. And that's why they end up going, and they love cuddles. And they don't really like to lie on their backs. And they don't really like tummy time. They usually don't like cars. Hello, bubs. So again, as we can see here, with Dario, he's doing a lovely, very localised technique. If you use your first finger to demonstrate for me, Dario. Yep.
On myself or?
No. On little gorgeous. Turn his head for me. You're in control.
Yeah,
That's it. Under the earlobe, by the edge of the jaw. Yep. Literally like you're pressing just behind his earlobe. And that's our key area that we want to look at. Where you do tiny little circles. The press you're using is minimal. Yep. And what we're doing is you're finding any lumpy sore bits. Yep. We're going to unravel it. And then we're going to unravel it literally 1 centimetre squares at a time, if you will. That's it. And then we're going to be looking at the other side. Now, this is the strange bit. This is where people get confused. To turn my head to the right, I tense this muscle on my left. To turn my head the other one, I tense the opposite. And we're going to find that the lefty is tighter than the righty. And from that, we unravel the springs. Because he's got no real use for his hands or his tummy or his back very much, these muscles do everything. And they don't want to get angry because they are struggling. Sorry, Bubba, but we found a sore bit, didn't we? And again, we'll find a knot. Oh, look at the bottom lip. Gorgeous doe. Fight the urge. Fight it. Does it hurt? It'll be a little bit uncomfortable. But as we soften it up and loosen it, it'll get nicer and nicer. So after we undo these springs, then what we do is we then look at the back of the skull, where the head gets squashed in. There we go. So his neck muscles are actually quite small at the back compared to all the meat at the front. There we are. Hello. Perfect. I know. So now what we're feeling for at the very bottom of the hairline, where the skull meets the neck, there's some big muscles that we use for moving ahead. And really when we're looking, now they will get crushed in. And they'll get very, very tight. I know, bubs.
Definitely tight on the left side, yeah.
And if I want to get really picky and geeky from an anatomical, I'm just educatory video, then what we're going to find is that the vagus nerve will be compromised on the left-hand side, which feeds the stomach. So there's a big nerve that runs from the left hand just behind the ear, and it's to do with stomach acid, gut mobility, and intestinal stimulation. And if that gets compromised on the left, guess what, guys? Everything slows down. I know, it's a sore bit at the back. Now, what we're going to do in a second, we like to do a bit of technique, and then we love to have a bit of a cuddle. So if you want to give him a cuddle in a second. Oh, he's a talker. Oh, wow. This is gorgeous.
Do you want to give him a cuddle?
Have a cuddle. Babies love a cuddle. Go on, have a snug.
Half-time cuddle.
Half-time cuddle.
Yeah.
It's important. Go on, pick him up. Give him a cuddle.
That's it.
I know, delicious. There we go.
Ah.
Have a nice snuggles. There we go. Now, rule number 1, when you've got a baby, is they can't really control their head. So whatever you do, always hold the head. It's a pet hate of mine, and I know it sounds like, oh, Bobo.
He's enjoying the treatment, isn't he?
I think he loved the treatment a lot, didn't he? Oh, delicious. So rule number 1, whenever you pick up a baby under about 4 months old, you always caress the head. Always stabilise the head. Never let go of the head. Oh, honey bear. Down again. Let's get into the thing he loves. I'm loving his outfit, actually. Down we go again. I'm sorry. Well done, well done, well done.
Yes, please.
I know. Now the noisy, but I'm sorry, honey bear. Oh, you liking this? Gee, you got the healing touch
Yeah, I
today.
know.
10 points Gryffindor. There we go. Oh, Dario, I think you've...
Made a mate.
You
Made a
have?
friend. Yeah.
You must have warm hands or something today. It's wonderful. So what Dario's also doing is, believe it or not, as he's working on the muscle at the back of the neck, he's actually pulling his neck nice and tall. So when your head does this like a tortoise, it's actually really uncomfortable. It's like wearing a pair of shoes that are too small and your feet feel like being squashed. Yep, babies love traction. Love traction. So it's a very nice technique, very simple. We're just doing little circles at the back of the head, just breaking down the muscle, stretching it out. Basically, it's like undoing loads of springs. I know you're talking day to day. Are you telling Dario everything that's going on? Really? Have you found a sore bit?
That left SCM again, it's quite tight.
Okay, again, it's the left neck sausage. So again, that's where the trauma came from. Unknowing to you, unknowing to the midwife, as he was pulled out and he would have been wedged in your pelvis, they pulled him and they turned him. And as they did, instead of it being an even pull, they went and did that. They pulled the left-hand side, so they pulled him like so, with his right ear to his shoulder, and they stretched out the neck. And they weren't to know, but it's a bit like you walking down the stairs, or you're walking along, and you just do that splits. You know, you slip, and then you're thinking, oh, that's going to hurt tomorrow. No bruising, nothing but... So all these babies, mummies know that their baby's not right. But if you did a scan or an MRI, nothing's going to show. The thing is, what can occur is as he gets bigger and stronger, and that muscle gets more angry, it can actually flatten the skull, which would have been on the right-hand side. I know, delicious. There we go. If you can do after that, it's a bit of a thoracic extension as well. So again, as you can see, what we're doing in this technique is we're breaking down the neck muscles in segments. But what people don't realise is muscles a bit like lasagna, it's layers. So we're stretching layer after layer after layer. Babies are gorgeous little elastic bands. Now, what we find with babies is when they become tortoises, it actually crushes the upper back as well. Now, the only problem is babies need to be able to lean backwards and arch backwards. It's very important action. But if the neck is tight like a tortoise, and if the upper back doesn't have the ability to bend to being squashed in a carrier bag, yeah, we need to love it, open them up. Baby should stretch like a cactus. That's what we want to see a lot, especially after a feed, actually. There you go. Does that feel all right? Strange, isn't it? So what Dario's doing is he's putting his fingers underneath, in between his shoulder blades, right by his spine, and gently teasing the bones backwards. It's a lovely feeling. When he gets older, believe it or not, he's going to lie on a sofa, and he's going to lie on a sofa and do it anyway. And there's a technique you can do where you lie him across your legs with his head slightly off the edge, watching him doing this. Whee! And they love it. Is that becoming more and more comfortable? Yeah, that's a very important thing for a baby to do. There you go. None of that would have been possible until we undone all the springs in his neck. I want a giraffe. That's what I want. Yeah? Come on, tell us a word. What's going on today? Beautiful. So we keep just gently lifting and lifting and letting him get more and more elasticated. See, I love this technique. Isn't it great?
Yeah.
I devised it years ago. It's like a baby code we discovered. And it always starts from the neck. So, yeah. Ooh. Dude, I've never seen a kid like lock into you so fast.
Yeah, he's pretty...
You should take up.
it, isn't he?
You should take up babysitting.
Babysitting.
That's the way for us. Again, just a couple of those until we feel the tissues are easing. So, there we go. So if you turn him sideways, if you can, it's easier for the video. Yeah, if you turn him so the head towards that way, that's it. Sorry, it's easier for you to move than me.
Mm-hmm.
Cool. So what we're doing now, we're just gently pulling the head from the bottom. The opposite as he turned up. We're trying to make him into a giraffe. Lovely technique. So simple, it's too simple. Undoing elastic band. I know wiggle chops. Really? Oh, almost got a bit. But there we go. Now this is what we're aiming to see is the bottom lip wiggling because the tongue starts going. You want to see tongues going. So at home, what I'd like you to encourage is you do it to him. He sees you. He's going to start to copy. But when the tongue's so tight and it pulls in, he can't bring the tongue up to the top of the mouth to feed clearly. Swallowing's a bit tricky. And this is a stretching technique they do. It's a very good sign to see a tongue.
Tommy?
Yes, please. So if you turn him 90 degrees, so then I can get a better vid.
Of course.
That's it. So he's going to go, head towards the shockwave. And then bum towards me, please. Yeah. Oh, you're not coming up. You're going to stay down there, gorgeous.
There we go.
So this technique is designed to jumpstart his tummy. He's got 16 feet to 18 feet of intestines. That's a lot of noodles in a little carrier bag. So we always think of it as a bowl of noodles. Now think of it as a wiggly worm or a conveyor belt. Now, there should be a lot of blood in his tummy. A lot of blood in his tummy, which allows us to wiggle and move the milk. However, I asked you about the if he's got any curds and whey, if he's got any of the yogurt. Well, that's milk that was 3 hours before, maybe even 6 hours before. Yeah, that should have been all the way down the intestines. But if the conveyor belt slows down, a traffic jam starts. And milk from, shall we say, 6 p.m. should never have met the 12 lunchtime one. They should never really catch up with each other until the back doors. So what we're doing here is we're feeling... So I'm just going to wiggle around a second. Whee! What we're doing here is we're feeling just under the rib cage. Yeah, it's literally like a bag of lovely noodles. And what we're doing is we're trying to feel at which layer inside his tummy. If you turn him a little bit more 90 degrees, please. So bring his hips towards you. Hips towards you, please. There we are, gorgeous nose. A little bit more if you can. No. What we're doing here is we're finding the rib cage. If you drop his knees out of the way a second. Yep, we put our fingers just on his rib cage. Just as we drop off the edge of the rib cage, we're on the upper tummy. This is where all the magic happens. And then what we do is we're using our fingers very flat as we can see. And we're going to wiggle and gently squish into the bowl of noodles. A baby's tummy should feel like a teddy bear's tummy or a soft fluffy pillow. But it never should be hard. If we've got firmness, that means you've got trapped wind and the tummy's not working. We have a traffic jam. That will cause a lot of pain. Hiccups. Yeah, a bit of reflux. But you don't ever want to feel that in a baby. But if it's soft as his face or squishy as his legs, then that means it's good. I know. So what we do is we use flat fingers and we're going to scoop about a third of the way in. And then what we do is we then scoop, as you can see, the fingers to the middle. I know. And then we hold it. And we hold it there for a count of 4 elephants. 1 elephant, 2 elephant, 3 elephant, 4 elephants. And the reason is the intestine moves a bit like this. And what happens is it gets clamped. So as you hold it and you pull it, it goes and opens up. So people visualise a wine bottle lying on its side or 3 lanes of traffic on a motorway. What happens is all the lanes should be open, but when there's a lack of blood, it deflates. So instead of it looking like 3 lanes of motorway, it goes down to 1 lane or a street cone or a wine bottle lying on its side. So what we're doing is we're opening up the area that's deflated and then allow all the food to move and it will jumpstart. Ah, that's gorgeous. As you can see, it's a very gentle technique. It's a very soft technique. It's a very, very slow technique. Now, all that I love you, doing that thing where you just stroke their skin. Yes, it's a big bowl of noodles. It's a big bowl. You've got to get to the layers where it's stuck. You're going to be doing this at the end. It's really simple to do. As you can see, babies love it. But why not make his tummy work perfectly? When they're young like this, they're still jump starting their tummy. They're not very good at getting their intestines going. They have times where it slows down. You are going to learn to jump start his tummy, and you are going to make things happen. You can make babies poo easily doing this. You can speed up his digestion. You can move wind. But you notice how we're not stroking his skin. I love you. I love you. Skin tummy. You don't want to polish your baby's tummy. You want to scoop it like folding meringue. Yeah, and you're going to do it until it starts to soften. Hello. And that can take a couple of minutes sometimes. Sometimes a couple of seconds. And what you can find is you can be chasing bubbles like blah, 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 gurgle, gurgle, gurgle. I know, gorgeous. The reason we bent the hips up at 90 degrees with a hand under the bottom is to stop your six-pack taking over. Absolute waste of time if you're crying. Yeah, but a baby, when they hiccup, this is a prime time. Hiccups are them trying to jumpstart their tummy. It's got nothing to do with their lungs. So if he does go, this is when you do tummy scoops. We're also going to teach you in a minute, hello, how to get things going. Hello. Are you got his hands? Do you have his hands? You are the perfect patient. You have to come again. Anytime. Yeah, what are you thinking? What are you thinking? Now what we do is we place our hands under his pelvis, a bit like we did with the upper back, and we're going to slowly create his lower back to start arching. So you push your fingers underneath and you push his tummy up to the sky, and this jump starts a lovely reflex which allows him to, when they're on their tummy, to start to want to come backwards. Again, there's a lot of leaning backwards in babies, but we stick them in car seats where they lean forwards. And the problem with that is it squeezes and squashes you, doesn't it? We don't really want that. That's not great. Tummy time's good, but a lot of babies with a neck trauma will not want it. When you're a tortoise, tummy time's horrendous. When you're a giraffe, tummy time's nice. Hello. Now, we're also going to encourage you, because we know that he loves to turn to the right. When you do tummy time, you're going to make him go left. If he's on your chest, you're going to make him go left. Because he's not glued now where he was, he'll actually start to enjoy it lots and lots more, okay? This is, honestly, it's bog standard stuff after childbirth. It's really common. And as you can see, even though we're doing loads and loads of work on him, hello, you're very photogenic, aren't you? It's not causing any trauma. But we could do this on you and you would love it. Oh, man. I know.
Can you speak? Make some noises.
Their breathing always fascinates me. Stick your tongue out. If you stick your tongue out, he should copy you. Go blah, 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 blah. If you honestly just keep doing it and he will copy you. Go blah, 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 blah. It's a natural reflex. And if you go awwa, 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 slow with the tongue. Blah, blah, blah. Very good technique to do with babies. Okay, in a second, what we're going to do, we're going to lift him up and we're going to hold him in what we call the seatbelt technique. When you're holding him upright, if you're trying to put your hand on his head and your hand under his bum, it gets exhausting and your arms want to explode. And he weighs a lot. We're going to teach you the nicest technique to how to hold a baby. Oh, I love that noise. It's a lovely technique how to hold a baby, which takes his neck off tension. It allows his tummy to move better. And it's so much better for you as a parent. All right? So what we're going to do, if we can, we're going to demonstrate the lovely seatbelt hold, please. So as you can see, the arm's going across his left shoulder. Yep, coming across just like a seatbelt. We're going to rest his face inside the elbow. Okay, and then we're going to pick him up. Boom. As you can see, it's a lovely technique. Now if we stand up, there we go. I've got to tilt my chair back so I don't miss it. Now his head. See his face? Those facial things called cheeks? There are pillows. Now, Dario has a spare hand. He can open the door and eat. Oh my God, as a parent, he can eat. Now, the other thing is you can place the other hand underneath as well. Underneath the other one. So you're scooping your hand under his tummy. Yeah, and just holding double scoopy. Yeah, and you're just literally holding him. Now, Dario's upgraded and he's doing the tummy scoop. Can you see that? He's got his fingers naturally under the left-hand side of the tummy, where the traffic jams generally occur. All right, and as he does that, he's slowly doing that tummy fold for 4 elephants at a time. And we call it baby guitars. Isn't it amazing? And you are going to practice this before you leave today.
Yeah.
Oh, honestly, it's a lot easier to think. It's not a hard thing to do. We're going to teach you how much pressure to use. It really isn't much pressure at all. And what you do is you walk around the house, you sing a song. Babies love mirrors, by the way. Okay, they love other babies. His vision at this age, how old is he now? How old is he? 3-4 weeks? How old is he?
Yeah.
Yeah, months? When was he born?
When 5th of November.
Okay, so we what, November, December, 3 months. Okay, happy day. So his vision's pretty good. He can see me quite clearly now. So he'll love, I want to see a big yawn. Okay. Now, again, you don't have to do anything. Just walk around the house, be in love, be happy. Yeah?
Yeah.
But he can see and he likes this technique. And believe me, he weighs nothing like this. Okay, big fan of this. But most importantly, it's taking his head off tension. He is on holiday. All right? You can swap the other side if you want to. But what you'll find is you cannot give us a baby in this room without us wanting to play baby guitars. Even if he's pooing twice a day, I'd still jumpstart his guts just because you can. If you think he's a bit windy, if you think he's a bit upset, if you think, look, you're fed, you're warm, you're safe, what's wrong with you? And these tummy feels, then you know to do baby guitars. Okay? Love this technique. And then what you do is you don't even have to do that. I know you're the happiest bunny in the world. Now, the other thing we're going to teach you to do is if we have him more upright, we're going to do some tick-tock clocks and some little mermaid's tails. This is to get his tummy working. You have him on, you're going to support his chest and his neck so he's not going to go down the gym. And then what we're going to do is going to do circles with his bottom, lambada. We do lovely big circles, big, massive, massive circles. Okay, then we can also go sideways like a tick-tock clock, left and right, or mermaid's tails. Then you can bring his tummy or his knees up to his nose, all the way up, really bend it up, loads. I mean, he can put his knee in his cheeks, honestly. He's a bendy little thing. This all jump starts the tummy. Again, it depends what you want to do out of life. But we like these techniques. Keep doing lambada, please. Big, massive circles. So we're going to really exaggerate how much the bottom hand does. Okay? Big circles. I want 50% greater than that. Keep your hand. That's it. Has he gone a bit concrete?
Yeah.
Okay, that's fine. That's it. Hand on his chest a little bit lower. Thank you very much. There we go. And you're just using your forefinger and thumb so his head isn't doing this. Yeah? We don't want him working out too much. All right? Again, tick-tock clocks. Go with what you can. All right? So, again, homework we're going to give you today is to keep his neck sausages happy by doing little circular massages very accurately by the edge of the earlobe down. Big neck sausage, it runs down here. Keeping those happy. His left needs more attention than his righty. And tummy scoops. And that is going to be your homework. And honestly, from that, as you can see, it was a lovely, that's exactly what you want to see. A massive yawn. Yes, it is delicious. You okay? Good. Now, in a second, it's going to be your turn. Are you ready? Don't look so nervous. So you're going to come round this side for me. Okay?
This side.
Yep, nearest my feet. And then what we're going to do, you're going to put your hand under his bottom. So your right hand under his bum. Dario's going to place your hands.
Mm-hmm.
So place your hand under his bum.
Just like this. Right hand goes under. If you stand a bit more to the side, perfect. This is for tummy scoops, is it?
Yes, please.
So just this hand, and then this hand. You want to see if you can feel the ribs first. Just saying, you want to go below the ribs, okay?
Yeah.
So we're teaching location right now. It's very, very important that parents are able to do this at home. So you're very well seeing us, the baby whisperers. But most importantly, if a parent can't do this on a regular basis, not really funny, the baby doesn't stop digesting. And babies are pretty much caterpillars. Eat, sleep, poo, repeat. So you really want to jumpstart those intestines on a very regular basis. I would strongly suggest, from my experience of working for 25 years with babies, you're going to be looking at doing it about every 3, maybe every 5 hours. And you're only going to be spending a minute jump starting the intestines. Brilliant. And the neck one is when and if you can be bothered. 10 seconds here, 10 seconds there. But the gut one takes a little bit more time and effort and is a very slow scoop technique. You can see this on our website, and you can also see this on our YouTube channel. So like and subscribe. Thank you very much. And in turn, it's a game changer. And it has changed so many parents' lives. If you can make a baby digest, if you can make it comfortable, you can reduce the wind, you've got a happy bambini. Very simple. And as you can see, mummy and son bonding time. She's not freaking out. It's not freaking out. Life's pretty good. Oh, it's so gorgeous. Goody gumdrops. 4, 5. So the reason we count in elephants is you can't cheat in the word elephants. But if you said count to 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. But if you go 1 elephant, 2 elephant, 3 elephant, 4 elephants, what we find is you can't cheat. Or, from a 4-year-old telling us the other week, flamingos. Strange, isn't it? That's an option anyway. Cool. And you do it until it softens, or about 5 times. Now, Dara, if we can, we're going to teach just how to massage the neck. Isn't that so easy? You think, oh my goodness, I'm going to be scooping my baby's tummy. That looks horrendous. Oh my God, oh my God. But it's actually a lot softer than you think, isn't it? It's not too bad.
You can see, yeah? I'm going to show you how to massage the neck, okay? So first thing first, just have a look. This is where we're going to be aiming for. Just behind the jaw and underneath the earlobe, okay? You only need 1 finger for this.
Accuracy is key.
Small. Hello, you okay? See if you can have a feel first of all. If you feel anything that's a bit tight compared to the rest of what you're feeling,
lumpy.
that's what you want to go for, okay?
Lumpy bad.
And then when you find a good spot, that's okay, mate. Small circles, okay? Not too much pressure, about this much pressure, okay? I'll show you in your hand. Just about this much pressure, okay? Nice
Super
and slow,
delicate.
very controlled. Yeah, have a little feel, see what you can feel. And it's the same for both sides, okay?
So the trick is to stay as tight up to the earlobe with your finger just right by the edge of the jawbone. As we can see, accuracy for this is key. Again, it's also one of our videos, and we will show you guys in greater depth the anatomy and why we're doing it. Again, little baby circles. You're looking at something the size of 5p piece. Okay, so you do the odd 5 wiggles here, the odd 5 wiggles there, but you stay so you're really close to the bone and the jaw, okay? Now try and find the same location on the other side. So my colleague's going to come around and guide you on the other side as well. There we go.
Hey, that's alright.
So again, key is
quite high up. I'll show you
stay
when you
tight.
press, okay? So just behind the jaw, underneath the earlobe. So it's still quite high up, just into there, okay? So about this much pressure. Oh, sorry.
That's it, so stay nice and high, almost literally behind the earlobe, all the way up. So on me, it will be literally there. That's where we're going, guys. A lot higher than you think it is. Just behind the jawline, right up inside there. Okay, stay high, stay local. Lots of chatting today. Yes and yes. The reason for noise is going to be a little bit more uncomfortable than the other side, but it's not horrendous. I know. Do you feel anything lumpy under your fingers? Strange, isn't it? Hard to describe the texture, but it's just a little bit firmer, like a rubber sausage. If you know what sausages, rubber carrot, I don't know. So again, that's it. And it's tiny, like the size of a pencil. That's it. The odd 5 here, the odd 5 there. Don't become obsessed. Don't spend an hour doing it. The odd 5 rubs, the odd maybe 10. Yeah, but we're not using a nail, we're using the flat part of our finger. Again, we're doing little motions. Little motions. Yes? Squishy, squishy. It's not much, is it? Don't forget, it's absolutely tiny. I know. Lots of mummy son body, like bonding, sorry. Excellent. I know. Job done. Well done you. You've survived a day with us. And so is he. And as you can see, isn't it weird? So it's a bit like baby mechanics, isn't it?
Yeah.
So cool. So we're going to send you videos that are relevant. So it's going to be his left tummy we're going to really concentrate on. His left neck more than his right. That muscle's going to get softer and softer to the point you can't even feel it. You're going to put your fingers by his neck and go, there is no sausages, which is exactly what I want you to find. So firm is bad, squishy is good. And yeah, whatever you do, never let the head go for about another month. It was about 4 months. Okay?
Yeah.
He's be a little bit independent, but I don't want him down the gym. Okay?
Yeah.
And then the way we taught you the seatbelt hold, or some people call it tiger in the tree, which I've never seen a tiger in a tree, then that will just give him huge amounts of relief. Maybe even if you want to fixate it just for about a week or two. Oh, it's so gorgeous. Oh, okay. And if you want to, we love people to just carry their children. My daughters loved it all till they're about 6 months old. They just love that technique. I put them in the Baby Bjorn like chest things. Or I obviously held them up, but it kills you when you hold them up like this. It really hurts your arms. But the seatbelt one, which we're going to make you do in a second, okay, is just amazing. All right with that?
Yeah.
Good. If you want to, Dario's in a second is going to get you to practice the seatbelt hold. Okay?
So I'll just run it through with you quickly. The easiest way I do it is if you set this left arm up already, then it should be very simple, okay? So on the inside of the arm, and the head just wants to be in that little elbow there. Hands through the legs, and then with this hand, you can easily just roll them over, and you can see his head almost fits in that already.
Yeah.
And then from there, nice and tight with this arm, and you can just pick him up, okay?
Yeah.
So the trick is to
Just
get
come
as low as
slightly to
possible.
the side. Come to the side more, towards me. That's it. Roll him into your elbow. Not great for the lower back.
That's it. Nice and tight.
That's it. You scoop them, boom. That's it. And then put your other hand. Oh, Bubba. Oh, he loves the bears.
How's
Oh,
that
angel.
feel there?
Yeah. It's simple.
Simple and easy, isn't it? So easy is too easy. Oh.
Does he feel lighter in one arm?
Yeah.
Put your other hand underneath. Now, what we're going to do, we're going to move your top hand. Yeah, just on the outside. So, Dario, you're going to help. So, you're going to put the bottom hand underneath, top hand just up.
And this hand, so you can get into the tummy.
You can see it. You can feel the edge of the ribs. And then that same tummy scoop. But now you're going to fold the hands up towards your chin. That's it. Slightly to the side. Yeah, so it's technically in line with his nipple. And that's it. And because your hands are going to be stroking his tummy because you're in love with your son. Yeah? If you're there, la 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 la, just giving him a lovely stroke. Think, oh, I'll throw in a couple of baby guitars. Scoop and hold for 4 elephants. Scoop, and that's it. And try it. Just scoop up. So press your fingers up into his tummy. So push for me. Dario's going to assist you. Yep. So then scoop your fingers. Dario's going to come in there. Facing towards me.
Lower.
Fingers just a bit lower. Find the edge of the rib cage.
So like this. Fingers close together. No separate. Like this.
Keep together.
That's it. And then we're just going to move these over to this side. And then we're going to scoop up like this.
Press and lift. Press and lift.
There you go.
Hold it again. That's it. Try and do it. That's it. You can go in quite a lot deep. When babies are crying, they go bulletproof. You can't do it when they cry. Oh, I think he's maybe going to get hungry. Everything we've done gives him the munchies. So it's very common after a feed to need to give him a snack. Oh, Baba. Okay. So again, easy technique to do. If you want to hold him like that, it's up to you. You can do one-handed, two-handed. It's your decision. Okay? There's your homework. Oh, and if you hold him with just one hand, so slide your hand with the ring through his legs again. We're going to teach you how to massage his neck in this position. So Dario, if you could assist, please. Take the top hand into the leg. Take the other hand out.
This arm. And then have this one up. There you go. From here, what we can do is we can massage into the neck. This hand.
How easy was that? So accurate. Just under the earlobe, by the edge of the jaw. Little baby circles. Hello. I know he's so tired. Little circles. How easy is that? Now you can also do the seatbelt hold the other way, so it would be in the other arm, and then you could find his neck on the other side. Again, the trick about being a parent is finding the opportunity. So if you're stroking his hair, you're very close to his neck sausage, aren't you? Okay with that? Lovely. Wonderful. Job done. Well done. He can either go in his basket or go in his clothes, or do you want to give him a little feed? Have you got a bottle with you?
Yeah.
Do you want to give him a snack? We're going to write the notes up. Take a seat.
Yeah, thank you.
Do you want Dario to hold him for you for 2 seconds? Are you okay? Yeah? Hello, gorgeous nose. You can do tummy time if you want. So, Dario, if you can assist here a second, we're just going to babysit. So, oh, he is hungry. So, another day in clinic. Baby Mechanics 101. Like and subscribe because there's going to be loads more.